The treatment of the tennis elbow or the epicondylitis. Many of the chiropractors in the States and other countries will have noticed that the treatment of the upper thoracic area alleviate or cure many of the symptoms felt in the elbow. So most of the epicondylitis that we see in our office should be diagnosed and basically investigated to find out if they are coming from the upper dorsal. Now there are no nerve from the upper dorsal directly to the elbow, and obviously it's a brachial plexus, so we suspect that the incidence and why it affects it is via meningeal tension. So now, as a patient comes in, I'm going to ask him a few things, and first I'm going to make him responsible a little bit of his care by checking with him different signs with which he can rely later on, and those signs will be an indication if the problem comes back or what is the level of the problem. Head rotation, I'm going to ask the patient to turn his head on the right and on the left, and then I'm going to bring in a mirror, and I want the patient basically turn your head on the right, and you can see the space between the dimple below your chin and the shoulder. And we're going to go on the left, and on the left you see you have a limitation in left neck rotation. You see that? So you can do that every morning when you have a little pain in front of your mirror and check out your head rotation. So we have shown the patient the head rotation. The next is basically to show him how much pain it's felt, and that you cannot evaluate it, he has to evaluate it himself. So I'm going to take a marker and I'm going to palpate on the epicondyle the area that's the most painful. Is that the most painful here?
Yes.
Okay, so I want you to palpate this area here. Find the area the most painful. You got it?
Yeah.
Okay, now what I do, I'm going to mark that area with a pen. Just nice little mark here. Beautiful. Okay, I want you to palpate that again. Okay, you will remember the pain at that level. Check it out on the other side to compare. Okay, now check it out on the right side again. Okay, good. Once I've done that, I'm ready and I'm going to treat my patient. There are two types of treatment for that. The main one is patient prone and using a thumb contact below the spinous of the second or the third thoracic vertebrae. And the other one is sitting. It's a Gonstead technique. Now, which side to treat? Generally speaking, and it's not etched in stone, you will take a contact on the opposite side of the lower shoulder when your contact is on the spinous. So in this case, pain on the right side, lower shoulder on the right side, I will take a contact on the left side of the spinous. Now the treatment, you have seen it in other technique. I will take my contact, tuck the chin in, put your feet in front of you, beautiful. Retraction of the chin, segmental extension, lateral flexion, each rest. Right after that, I'm going to ask my patient, please, would you mind to touch your elbow? How do you feel? Do you feel less pain?
No pain.
No pain. So you have a good improvement. Now, if we have a good improvement following a treatment, this treatment or lying prone on a table, either one of them, sitting is better because we can check out the range of motion before and after. And at the same time, we have a better evaluation of the pain level by the patient. Now, if the patient tells you, yes, I feel much less pain, you have used the adjustment as a diagnostic tool. And it's a great diagnostic tool, not often enough used. It's inexpensive, it's safe, it's duplicable. So what better diagnostic tool could you have than that? So once it has been determined that the pain is coming from the neck, the patient knows about it and it can help you in the outcome of the treatment. He now knows that his pain in the elbow is related to the neck. And this is extremely important because most patients have no idea that pain in the elbow can come from the neck, and most people will not protect themselves adequately for that reason.